My name is Adrienne Morgan. I'm a medical research scientist, and 7 years ago I was diagnosed with breast cancer, and 2 years ago I was diagnosed with metastatic breast cancer. I've been involved as a participant with 3 clinical trials, and I'm now, much more recently, on trial management groups for a number of clinical trials, and I'm also involved with the breast cancer campaign tissue bank, both as a researcher, in fact, and on the management side as a patient advocate. Well, when I was diagnosed with my cancer, I had about a month after I had my operation, I had a letter through the post asking me if I would allow my lymph node that had been taken out during surgery to be used to calibrate a machine that would hopefully speed up the diagnosis of lymph nodes in cancer during surgery. And I was absolutely overjoyed. I just thought, wow, this is wonderful, that my lymph node, which is no use to me anymore because it's full of cancer, is actually going to do something useful. And it won't benefit me, but it will benefit other people. And I still remember that feeling of, wow, my tissue is going to do something useful. And so through the breast cancer campaign tissue bank, as a patient advocate, I've been wanting to ensure that many more patients have that experience of feeling something good coming out of such an appalling experience. So people are consented, when people are consented for donation to the breast cancer campaign tissue bank, a research nurse spends a good half an hour to an hour with a patient explaining what will happen with the tissue. And I don't know what the numbers are, but very few patients say no. And most patients are absolutely delighted to have been asked and feel as though, as I say, something positive, something good has come out of that. On the other side of it, as a researcher, I'm also working in the laboratory, working on some of these tissues. And it's very difficult to explain how absolutely vital these tissues are for the further development of research. It's the speed of research, the speed of new drug discovery, of cancer mechanisms, cancer pathways, is going to be immensely speeded up by the availability of this tissue donated by patients. There is very good evidence that if you're involved in a clinical trial, you have better outcomes, regardless of whether you're on the treatment arm or on the new treatment arm. And that's because if you're involved in a clinical trial, you get absolutely gold standard treatment. And that's not necessarily true if you are being treated. So the gold standard treatment has been standardised for that clinical trial.